Okay, welcome to this session all around mental health. So, as you know, through the Multi Schools Council, everything we do is designed with young people. Over the last few years, we have been delivering a mental health session for staff in a couple of parts. What we have tried to do in 2024 is condense that, slightly, and basically bring together some of the common themes that have been coming up from young people in the last couple of years. So all of our sessions need constant updating, and this session is no different. So what we have really brought into this one is our work around self-esteem, which we now have a program for, which we'll tell you about. Also, our work around school attendance as well, and how that can have an impact on young people. So we hope that the session will be informative. There will be some things that, if you have heard the session before, are good reminders. But there's also some new content in here as well for all schools. So hopefully you find it useful as we go through the session. So, like our other sessions, we are kind of making you aware again of the Maslow's hierarchy of needs model. And the reason for showing you this again is because for us, looking at how we support young people's mental health in schools and generally does start with this model. It's a model that we've used with young people as well that once explained to them, they can understand. So just to recap this, obviously everybody has their own needs. So in essence, everybody has their own triangle, which means everyone wants to be at the top of their triangle. When you're at the top, that's when you're feeling your best, doing your best, and all of that stuff. But we know that it's not realistic to be at the top of that triangle every single day. So the only way we can get there is if the needs below are met. So down the bottom are what we would call the basic needs, the things that keep us alive. And then you can see your safety, belongingness, and self-esteem. In some of our other mental health sessions, we've reflected on each layer to look at what is it that young people need in each of those layers to make sure that they can get to the top of their triangles, but to also remind young people that if you were to draw a ladder next to that, this is real life, that sometimes you may start at the top, things may happen, you may climb down, but it's about finding the skills to be able to climb back up again. And we think that's a really good kind of visual picture to use with young people. So down the bottom, we've spoken about things before, like breakfast clubs, making sure we're welcoming, etc., etc. And we will recover some of those things as we go through this session. The other thing to remind you of is that within our work, we are very much looking at early intervention with young people. So based on feedback from them and some of the skill sets that we have within the team, and by working with other teams within Essex who also have that kind of early intervention knowledge. So this session is aimed at supporting young people who are hopefully in the green or may have moved into the yellow as part of this mental health continuum. What this session is not designed to do is to support young people who may be already within the orange or red sections of this continuum, because that's very much where they will need that specialist support that may be provided elsewhere. What we are looking to do is ensure that young people don't move into those areas, so they have those skills and those prevention skills, because the analogy we always use is that if we are constantly pulling people out of the river, we're never going upstream to find out why they're falling in the first place. Some of the information you will hear today is based around why young people might feel like they're falling in, but hopefully we can very quickly pull them back out again. Historically, when doing these sessions as well, we have put this slide towards the end, but actually we've reflected on this, and it's really crucial that although this session is aimed at supporting young people, you also do it as self-reflection about how you look after yourself. None of us working with children can support them to the best of their abilities or our abilities if we're not in the right place. So it's about making sure you have those things in place for you, and some of this might be appropriate as well. So it's not a throwaway comment. It's not just something we should say at the end. It has to start with prioritising our mental health if we're going to support others. So looking at building the basics and reflecting back on Maslow, as we mentioned, some of this has already been covered before, but it always serves as a good reminder because that has to be the foundation to build upon. So thinking about those basic needs and how to support them. So things like, has your school got a breakfast club? And if you do have a breakfast club, how is that breakfast club used? Not just for the nutritional value of young people obviously accessing food, but actually is that an opportunity to have some social time for staff to meet with different young people, potentially for music to be involved in there, that positivity to start the school day. Thinking about how you have staff available to check in with young people, we appreciate that there are a lot of pressures on staff working in schools, but it's about thinking again creatively within the structure. How can you make sure that young people have that opportunity? If we really think about early intervention, sometimes just a conversation, although it sounds so simplistic, can be enough to stop a young person falling into that river. So, how are we able to do that within the structures that we have? Worry boxes, again, some of this isn't rocket science, but we know that using them in different ways can help. So, for example, some feedback we had from young people before was that a worry box in a classroom might not be something they want to access because all of their friends will be there and kind of watching. So maybe having worry boxes at different parts of the school, and we've seen schools apply that with success, has then enabled young people to communicate better with staff about their worries. Obviously, again, looking at staff capacity, but things like home visits or just having those touch points with family members is really crucial to understanding those basic needs of what is being met and what isn't being met. And this isn't from a judging point of perspective, but it gives you that rounded picture of that young person to help build those foundations and support their mental health as they travel up that triangle. Obviously, lots of research in terms of exercise and the positive impact that can have. This doesn't mean that we have to go and run for miles and miles, because obviously we can venture the other way of over exercising. But even just getting young people up in the morning, moving around the classroom, whatever it might be, that kind of morning exercise is really important. Knowing what other support is available, we're going to give you some links at the end of this session. But I think the message we always reiterate at the start of our mental health sessions is that if you are referring on to other services because you feel like they need more support, you're not failing that young person. Okay, it's not that you are letting them down, you're actually helping them even more. And it shouldn't be a self-reflection of, oh, we couldn't support them. It's they now need another level of support. Just like if we were to compare that to physical health, then there might be with some things that we can put a plaster on. With other things, we know that there's more medical support that's needed. And I think we need to view mental health like that as well. I know you can throw back to us and say that unfortunately there are sometimes long waiting lists and that support isn't always readily available, but we will give you a range of links. A positive activity to start the day. So again, something that CAMHS recommended to us a while ago now was, as young people enter your classroom, could you have a PowerPoint of cute animals, for example? And if I was doing this session in person, usually I would spot at least one staff member smiling. It doesn't have to be animals. It can just be something positive, something that the young people in your class are really into at this current time, something that is going to be a positive start to the day. Obviously, having those conversations is all about breaking that stigma. So just talking about well-being, mental health, physical health in the same bracket, and really just getting it part and parcel of the conversation. I think we have seen improvements in that. I think the schools we visit, it's more open. Young people are more open to talk about it. There is that change in culture, but I think we still need to work on that. So thinking about, as a school, as part of those basic needs, having conversations about well-being, or how can young people in your school and in your class communicate about their well-being? If it's not through words, what other things and tools do you have in place? And then building on positive relationships with staff, that speaks for itself. I don't really need to add anything on there, but we know from speaking to young people that's absolutely vital to keep them in school. So going further and building on those basics, some questions and things for schools to consider based on, again, feedback from young people of things that have been really supportive in that early intervention stage. So therapy support, what does that look like in your school? So that could be animal therapy, it could be specific members of staff that are trained to a certain different level, maybe through art or play. Just looking at that overall support and well-being, what do you have in place in school, and is there a need for something more? A safe space is really interesting one. A couple of years ago, we ran a competition in Essex with young people to design what a good safe space should look like in schools. And some feedback we had at the time from a young person was that, but shouldn't every space be safe in a school? Really interesting. So there are two sides to this. Some young people are explaining that having a designated space in a school where they know they can go when things are not going well is really important to them. And that's what they mean by safe space. But actually also reflecting on the overall safety of how young people feel within your school, I think is really important. We know outside space is crucial as well to using that effectively. We know not every school is blessed with lots of outside space, but being creative with that again, how you use outdoor learning opportunities. Again, some lots of research to show that outdoor learning can have some real positive effects on mental health and well-being. Obviously, that first interaction is crucial. So again, if we think about the start of that school day and how young people are communicating with us, it's vital. So often we'll hear children talk about their head teacher or a staff member who's on the school gates every morning, and how what a difference that makes to them, because there's that visible presence and they feel welcomed into that school. But maybe it's at the classroom door, or maybe it's a staff member who they've got a really good relationship, or even it's a peer member, so it's a friend, somebody that they know and like, and that first interaction is crucial to ensure that they start to feel in a good place in the school. And making sure that each day is on a new page as well. So something quite negative could have happened the day before, but that first interaction on that new day, rewriting that story, starting a new day is really crucial. I think there's definitely something at the moment from young people and families we speak to around the economic pressures and the impact that can have on children's well-being, mental health, and those basic needs that we've just been talking about. And I think understanding your community and where they're at is really important. Music. So you may have heard us say before that when we did our school attendance report with young people, music came out as something that young people felt was really important to have within school, and had a really important impact on their mental health. And so it's really important to consider again, how do you use music in your classrooms, around the school, as children come into school again, because we know music can change mood. Reflect on that yourself. If you hear a certain song, or you're playing music in the car, whatever it might be, that can have a positive effect on all of us. And it's thinking about things like that too. And then evaluating the school culture. So what do we mean by culture? How do young people really feel in the school? What would they say if I asked a young person? They may not understand that word, but if I phrased it another way, how could they really tell me about the school? And are you confident that young people would have a positive culture that they feel positively impacts on their mental health? So thinking about how you do that, maybe at the start of each year, at different points in the year, how do you measure that? How do you evaluate it? I think is really important. So at this point in the session, we will ask you this question. It's a question we've used again historically through these sessions, but we think it's really good to reflect on. So what helps you to feel safe? The example I always give, because it sticks in my head, is a lady once put her hand up in my session and said that she feels safe when she's driving and it's not her husband. When we broke that down, we spoke about the need to feel in control of different situations, which lots of us may feel the same in, but actually reflecting on that first ourselves is really, really important. And the reason to reflect on it ourselves is because often our safety needs are deep rooted and they've come from early experiences, and so they will stay with us. And so it's important to reflect on that, because young people obviously are going to share similar things. Some of the things that young people have communicated to us in terms of what helps them to feel safe, particularly in school. So that preparation and communication. We all know what it might feel like as a teacher going into a lesson and potentially you're covering and you haven't had that time to prepare, and how that could make us feel in that situation. Young people are going to be the same in terms of if they're walking into something that they haven't had the information on. For some young people, um, especially with SEN and other needs, that could be a real kind of barrier to them feeling safe within that environment. So how we prepare and how we also communicate that. So for some young people, we could just verbally tell them, fine, they've got that. Others may not understand the way we've communicated that. So it might be through pictures, it might be through a follow-up email later. It could be different ways, but obviously all young people are going to be different, and we need to understand that. The number one reason why young people told us they didn't want to come to school when we did the school attendance report was bullying. So again, I think there is something in making sure we talk about anti-bullying in assemblies and in class, absolutely. But from young people we speak to, that's not going, far enough. So involving them in the anti-bullying policy. Some schools we've worked with have anti-bullying ambassadors. I think it's important to consider, are we doing enough to tackle this? Because we know it's the number one reason why some young people aren't coming into school. Flexible approaches to start and finish times based on needs. So again, thinking about individual needs, just moving those goalposts slightly to a point where a young person feels a little bit more in control of that situation can help. So thinking about, do you have those flexible approaches to start and finish times if needed? Using technology. So again, we know that through COVID, obviously, we really embraced it. We had to. Some young people we know really benefited, and it's actually thinking about, if young people again have got certain barriers to accessing a certain element of the school day, how could you still involve them through the use of technology? I think is important to reflect on. What communication channels can your young people use? So again, some young people have spoken about really good systems within their secondary schools where they are able to communicate with the school outside of school in a safe and structured and monitored way. And this can be really useful, but also just generally, again, thinking about, how do you enable young people to talk to you if the words aren't there? I think that's the important bit to reflect on. Again, how do you check that young people have understood instructions? So we talk about that in our speech, language and communication session. Really, really key, that receptive language. Have you monitored children's receptive language skills? Because actually, if they're not taking in that information, maybe then they don't feel prepared, they don't understand, and that can lead to different feelings that will impact on safety. A poor diet, I think, kind of speaks for itself. So understanding that and how actually food can play an important role in all of our lives, but it can impact on how secure we feel in a certain environment. Attachment challenges. So we reference some of the little handbooks, the attachment awareness series, which gives some really good kind of pointers. So you can look them up. But understanding children's attachment challenges, and I think we've seen that more going into schools again since the pandemic. Understanding that, and then the adjustments that might need to be made to ensure that even though there's that strong attachment maybe to a family member or something else, that we're able to still support that young person to feel confident in school. Things like temperature, again, speak for themselves. So if we are feeling really cold or hot in a certain situation, we won't respond in the same way, and we won't feel as comfortable and therefore safe. Lack of sleep, again, we could reflect on ourselves. If we don't get enough sleep, for some of us, we know how that might impact us, and obviously young people as well. So one of the questions, again, is and it always causes an interesting debate, is if you had a young person going into your class who you knew had a severe lack of sleep, would you let them sleep? People have different opinions on that, but I think it's more about the understanding and how we approach something based on what we know. We may not always know, but I think it's important where we can to get that kind of whole picture. And substance abuse, obviously this session could be used in both primary and secondary schools. So certainly within that primary sector, I'd like to think there wouldn't be any young people who are substance abusing, but it may be that they are seeing that at home, have witnessed that, and how that may impact on their ability to make meaningful connections with other adults. In secondary schools, again, obviously would like to think that young people aren't substance abusing, although we know that that can happen. And again, it's looking for those signs of kind of extreme withdrawal, real flips in mood, those real kind of changes in behavior. And again, that might not always lead to substance abuse, but it's about being aware of that and sometimes exploring those things, because again, those things will make certain young people feel paranoid in different situations, and impact on how safe they feel in an environment. So we're going to move on to anxiety, which is a new section really within the mental health session that we deliver. And the reason for that is because we were getting a lot of feedback from other young people, basically, that they felt, in their opinion, anxiety was becoming a bit of a buzzword, and that people were really kind of starting to misunderstand it and lose sight of what anxiety actually means. And I think when we explain this, we always have to choose our words really carefully, because absolutely crippling anxiety, extreme anxiety can change people's lives and can really impair their ability to to get involved in different things, and obviously can lead to severe mental health challenges. But we've really reflected on this with young people, because we had young people as young as 7 and 8, saying that they suffered with anxiety. And I think it's about exploring that a little bit more with young people. So we have explored that word, and these were some of the things that kind of young people mentioned, that actually when they use that word anxiety, it could mean a range of different things, and it is about exploring this. So young people were talking about anxiety being a feeling of feeling scared. So actually, what is causing this? What's fueling that feeling of being scared? And is there something or an intervention that we can put in place? Could be linked to overthinking. And some of the advice here was around kind of that living in the moment, so breaking things down into windows of time, but also using activities like the bucket activity that we use in both our resilience and self-esteem work, which basically gets young people to consider anything that they might be worried about right now, add it into that bucket, and then highlight or star anything they feel that is in their control. So if they would go and get some support or do something differently, that worry would very much be reduced, and to leave blank any worries they feel are out of their control. And that starts to rationalize it and prioritize it and put it into a little bit of perspective. And then around the outside, start to think about the things that could support that bucket to be reduced so that it doesn't overflow, and you can start to put that tap on them to run out. There's more detail about that in the resilience and self-esteem programs. It could mean challenges with friendship. So young people spoke about feeling of anxiety linked to a breakdown in friendship. And so again, understanding that and exploring that and thinking about what do we have in place to support friendships. It could be linked to nervousness. So that, again, from what young people were saying, can often be linked to a lack of preparation and not knowing about what's coming up. So again, how do we provide that information for young people? Loneliness, absolutely, we have heard from young people is on the rise in terms of, again, since the pandemic, being a kind of hangover from that, but things and services being cut so that young people feel there isn't as enough or as many options maybe as before. But thinking about in a school, what kind of integration activities do we have? What's our club offer? How is it inclusive? And all those types of things. Especially young people were saying about feelings in the stomach. So again, it's about having a bit of awareness linked to our constant messages around well-being, that actually some of that is a natural body response in terms of how we might feel in different situations, and for that not to necessarily mean that we are anxious. It could be linked to anger, other young people were saying. And again, like we heard about kind of being scared, what is causing this? It could be a mixture of emotions, and can we pinpoint that? So we know, a lot of schools will use things like zones of regulation now, but actually, is there other things that we might need to explore if there's a mix of emotions going on? It could be around that kind of talking support, could be another way of very much reducing that anxiety, just having somebody to talk to. So we said this earlier, sometimes just having somebody to talk to could be enough to make sure they don't fall in that river in the first place. And mistakes are okay. So again, young people were talking about the feeling of anxiety linked to school and making mistakes, maybe in front of friends or in front of teachers. And actually, again, those constant messages that we all make mistakes every single day. And it's important that mistakes are okay, because that's how we learn. And those constant messages, not just once or twice a year, but constantly. So linking back to this again, it's the statement that we always use, that every behaviour is a form of communication. So if a young person is acting in a certain way and they may link that to anxiety, what is it that communication is trying to tell us? Where has that come from? And so keeping an open mind with it, not just responding to what we see in front of us, but digging a little deeper. So a question here will be to ask you what helps you to feel a part of a team. So you will reflect on this within the session. And so some of the things young people have mentioned linked to that question, maybe things that you guys have just spoken about. So some key questions really for some of this is how are you involving parents within your school community? So young people were talking about that if their parents and families feel connected to a school, often that will have a knock-on effect to them. So thinking about how do you do that through coffee mornings, through ways that you interact with with parents, inviting them to different events, all those types of things. How does that have an impact to the connection and belonging for young people? How are we motivating young people to want to be in school? The language there is really key. Want to be in school. So we have spoken to young people in different meetings where there's been debates where some adults have said to young people, yeah, but you have to be in school. Okay, now we know there are certain laws and bits around that. However, for young people and the way they view it, are they going to view it like that? Or is it we need to turn it around a little bit and think about why would they want to be? So what's the want? What's the motivation? And I think that's the key. Can we understand young people's motivations to want to be in school? And how can we help to influence that? Do your senior leadership team members spend time with young people, proactive time, connection building time? Because that's what young people have said can really help. So if they feel connected to the people at the top, they know that everybody else is buying into that team ethic. I think that's really important. We see that in many walks of life. Children are going to want that too, probably even more so. So how do we do that with our SLT members? Peer-to-peer support. So we know, again, from research and speaking to young people, when they get to a certain age, we are not enough. As adults, as parents, we are not enough, and they will need that connection, belonging to their peers. So how do we support that effectively? How do we equip young people to have those skills, those social skills, to enable them to build those connections with their peers? Reasonable adjustments link into this as well. So thinking about our ordinary available offer within schools, and making sure that if young people are telling us that there are certain things they need, we may not be able to always do everything, but we've heard them and this is what we're going to do. So it's not a straight no and dismissive. It's a we've heard you and this is what we will try. And that's why reasonable adjustments, I think, is a good term, because it needs to be reasonable because it needs to work for everybody. But most importantly, the young person needs to feel connected to that. I think we've already mentioned about anti-bullying policies, but things like uniform policy we know are really, really key. Again, linking back into that school attendance work and report, we know that where young people feel like they've not been consulted or involved in that kind of uniform aspect, can be enough to prevent them from coming in. And it's crazy when we think about it, that what we wear may then prevent young people from accessing learning, from accessing that well-being experience of being in school and being around friends. So involving them. Check-ins we've spoken about time and time again, so important. Probably more so from secondary age children. We've heard things like, well, when I come to school, I just feel like a number. Nobody really knows who I am. I'm just going through a system. And so I think those check-ins and points of how we do that is really, really important. I think developing our ability to listen, we can all have so much going on our plate in schools, so many things that we're thinking about, but being able to stop ourselves and really listen, I think is a skill in itself. And how do you upskill staff to be able to do that? Making sure you have the right equipment. So it is that kind of young people, if they don't feel like they've got the equipment to be able to do their jobs, as some of them have put it, do their jobs in schools, then actually they're not going to feel like they belong. And so making sure we've got the right equipment for students to access their learning and education is really, really important. And relationships, again, this is a common theme, isn't it, on all of the slides? Relationships, it has to start with them, and that's what will again link into connection and belonging. So it takes work. I think, as we've said, this session is really focusing on that kind of school attendance element. And as young people have said, that it's not going to work for everybody the way the system is. And we're not going to go into loads of detail about that today, but actually the way things work within schools is not going to work initially for everybody. I think we all know that. So it takes work to be able to ensure that we can adapt. So individual approaches where possible and understanding that individual are key. That understanding of different needs. So how do we make that clear? How do we ensure all the staff know about young people's different needs? That's not just the SENCO's responsibility, is it? It's thinking about how do we make that clear for everybody? How can the young people themselves make that clear? And how can they have the confidence to be able to talk to you about that? As staff, reflect on ourselves and make sure we're in the right place. I can definitely reflect on my teaching career so far and think about there's times where I may have not been the best person at that point to deal with that situation, and that could have been for a multiple of reasons. But being open and aware to that, I think, is really, really important. Thinking about how do we empower young people's self-regulation skills and their resilience. So resilience manual is something we'll refer to at the end, but those self-regulation skills, ultimately what we want from these early interventions is that we are given the tools and the skills to young people to be able to successfully manage their well-being and mental health themselves without our interventions. And that's what we should all be aiming for. How we use positive reinforcement strategies, absolutely we need boundaries. Young people tell us that they need boundaries as well, but how we use positive reinforcement strategies to ensure that young people feel like they belong and they're connecting to the school is really important. So to really kind of think about, when you deal with different situations, how are we making sure there's some positive reinforcement strategies involved with that? We know for some young people, and a growing number of young people, there are different ways that they're accessing school, and one of those is through part-time timetables. I think advice we've had from young people, families, and other colleagues surrounding that is that part-time timetables, a bit of a mouthful, can work as long as there's a forward plan. So sometimes they can be put in a kind of crisis situation, or put in quite quickly from what we found, and ultimately there was no but what next. So it's actually looking at those steps of, if this is going in place now, this is the timeline and this is how we're going to do things, and involving the young person and the family within that. Now there might need to be some flexibility with that, but at least we know the direction in travel that we are hoping to go in. Think about how you share practice. If you have challenges with attendance and well-being, have you spoke to the school down the road? They may be feeling very much the same, but they may have done something very different. And so it's about making sure, how do you have those links with other schools as well to see what is happening, and what do other young people think maybe in other schools. And I think that's really powerful. Up-to-date records, I think, again, for young people, from them telling us, they can feel very frustrated when they have to keep telling the same story again and again and again. And that could be due to a family situation, that could be about their own need, but actually having those up-to-date records so a young person doesn't have to keep telling that story is really important. And a really contentious one that we've had conversations with schools in is around isolation units. We are yet to pick up some positive evidence in terms of why isolation units are there and why they work. There may be that out there. We've not come across that literature yet. We've not come across those views from young people. That's not to say that isn't out there, but I think from everything we found is that those types of approaches, without any kind of positive reinforcement or positive reintegration, often lead to more and more challenges, lead in some circumstances to trauma, and actually how that's unpicked and worked with then can be very, very difficult. So thinking about other ways to do things, because we know we need boundaries in place, I think it's a really important conversation to have. So just reflecting back on Maslow, I don't need to say any more words here, but within this session, it is just about reflecting back on this and thinking about what we've said so far, especially around kind of school attendance at each layer. What is it that you're doing to really support that, and how does that impact on school attendance, and then more importantly, children's mental health? So another question for you to reflect on is something that we have started to do within our sessions, and it's generated some really good conversation. I'm not going to tell you what other schools have said at this point, because it would be a great opportunity for you guys to have that conversation now. So building on that slide, and kind of once you've reflected on is self-esteem and mental health problem, we, as I've mentioned, have done quite a lot of work around self-esteem in the last couple of years, to the point where we produced a 6-week program, similar to what we did with resilience, where young people really influence that program to help build their self-esteem. So just to mention some of the things within that, and again, at the end, we will give links to the program as it is in the form of a manual. So we know that positive praise is important. Again, sounds really simplistic, but the message here is about us knowing the individual. I've worked with, and I'm sure lots of you have, young people that if you were to praise them in front of others, it could be the worst thing that you could do. So it is about knowing when to do that, how you do it. Might not be through words, could be through a note, pictures, whatever it is. It's important to know. We all like a reward, so it's thinking about your reward systems. How do they really grow self-esteem, self-achievement, self-confidence? Remember what young people say is crucial. Again, I know it sounds really, really simplistic, but if we can make sure that we are really listening to young people, to those skills we spoke about before, that is so powerful. The story, very quickly, that I always mention is when I delivered this session, a head teacher was saying about how every lunchtime he would eat with his students. On this particular day, he was wearing some different trainers because he was practicing for a big walk that he was doing. And this young person asked him about those trainers, and he told him about the walk. 2 weeks later, the young person come back and said, "Oh, sir, how did you get on with those trainers?" And the head teacher said it made him feel like, wow, that young person really listened, took on board, and wanted to check back in with me. If we can do that with young people, that's really, really powerful. Taking time out, so thinking about how do we allow the pace of the curriculum to slow down to support young people's mental health, but then also to help boost self-esteem levels. So things like meditation and yoga, there's some really good evidence to show how that can work. 5 ways to well-being is an approach and something to look at, especially through the trauma perceptive practice that's been rolled out across Essex, and some really good kind of tools and stuff linked to that. Growth mindsets, where's that gone? Where has that gone? I think that's what young people have asked us. It was a buzzword again a number of years ago now. Young people were saying that actually they felt it was something that was really positive, especially linked to self-esteem. So thinking about how you promote growth mindsets within your schools, I think is important. Clear boundaries, we mentioned earlier. When young people don't know where they are, when things are grey, often they can then start to doubt themselves, but having really clear boundaries on certain things I think is important. Get young people to self-reflect what's gone well. Okay, often in this country we can think about what's not gone well, what's going to go wrong, but actually can we flip that? It's that whole kind of half glass full or empty, and everyone's going to be different, but actually giving those self-reflection activities can be really key. Goal setting. So often young people in schools will be told what they've got to achieve or what they're expected to achieve. Actually giving young people a bit of ownership over their own personal goals and actually getting them to do that can really help with self-esteem levels. How do they value themselves? So what is it that they do to support themselves, and also what do they value in others? So it's that value aspect. Obviously, where young people have very low levels of self-esteem, it can be really hard to value anything. So making sure that you look at how we value ourselves is really important. The triangle, Maslow's hierarchy of needs, what's in that triangle? Because obviously underpinning self-esteem are those 3 layers beforehand, that belongingness, that safety, and those basic needs. And what is in young people's triangles to make sure they support their self-esteem? Thinking about why we respond. So our natural responses, our brain's responses, our freeze, our flight, our fight. Getting young people to understand that again can all help to kind of give that understanding to that self-esteem, and make young people more conscious, I guess, of why they might do things, and so that it's not just I'm a bad person or I'm always going to do this or be like this. Actually getting them to reflect on why that might have happened. The upstairs downstairs brain links into that really nicely. Again, some really good stuff there linked to TPP. And understanding empathy, we found in our self-esteem program, it's a really good opportunity to explore that, and enables young people to explore that emotion and see how that links into self-esteem and how they feel about themselves. So coming towards the end, but also getting you to reflect on this. I think for us as well on this slide, it's important we get feedback from schools around what they feel young people are saying on this topic, what is damaging young people's self-esteem, and therefore what can we do to help improve it. So some links here as well. I'm just going to quickly touch on them, but they are all things that you can go and look up, either through websites or apps. The first is our resilience and self-esteem manuals. So 2 separate things. We have a 6-week resilience program and also a 6-week self-esteem program, which now any school can access. via Hive, which if you have done TPP, you will have access to, or the Essex info link by either searching resilience or self-esteem. You can also contact us directly though as well if you want further information about either of those manuals. Young Minds heads together, some really good websites there to look at, and charities. Kids Inspire, an Essex-based group, do some really good mental health awareness assemblies and links into kind of staff training as well. So Kids Inspire are a great group to look at. TPP is obviously, again, an approach being rolled out by Essex, which really looks at that trauma perceptive practice, and we would recommend any school who hasn't done that to look at that. Koof is a brilliant app aimed more at secondary aged young people, and a Freud Centre is again worth looking up, some really good resources there. CAMHS is our local mental health service, and again it's about knowing how to access CAMHS if needed, but also more importantly the early intervention groups and strategies below that is always worth asking about. Children and Families Hub can give some really good advice, especially if there's kind of concerns around safeguarding linked into wellbeing. That could just be a good number to ring in terms of getting some impartial advice. The mental health in schools teams are being rolled out, and it's important to kind of ask about them if you feel that your school could benefit from a mental health in schools team. There are different cohorts, and I think again speaking to kind of partners outside of the school, either in education or health, should be able to kind of advise a little bit about that. Bright Futures, Bright Futures website, Headspace, another app. Place to Be, again, is another website and charity, as is Rethink Mental Illness. So these are the ones that have been recommended to us, mainly through young people initially, but also through some of the professionals we work with. And that's that. If you have any further questions on this session or want to book this session in person as well, you can get in touch at mschoolscouncil@gmail.com.